are going into a health update by Brother Kelvin Sapp. And is Brother Kelvin in the building? Kimberly, are we pivoting? Let me see. I got a message. He has stepped away. All right. Well, I will hold space. Hopefully, he will return shortly. Today, I know that we'll also have a beautiful a poet spoken. There he goes. All right.
Okay.
Hey, how are you, Brother Calvin?
I'm
Welcome.
doing well. How are you doing?
I'm very, very well. Well, I
Great.
will pass the stage over to you to inform us and update us on our health and what we need to know for 2022. Thank you so
All
much.
right, great. I am not certain, but am I sharing my screen or are the slides loaded? I know that I did send them to Kim.
All right. Well, she'll definitely take care of that. Let's see what the message says. She's loading them now so you
All
can,
right, great.
she has your back.
Thank you. And so while we are getting the slides ready, again, my name is Kelvin Sapp. I work with New York State of Health, which is the official health plan marketplace for the state of New York. Of course, we are part of the New York State Department of Health, and we implement the state's Affordable Care Act health insurance programs. And so today I'm endeavoring to give you just an update for 2022. For some of you, this information may be completely new, so I'll take a little bit of time and go through some of the basics about the marketplace, and then I'll share some important updates that people should be aware of, especially as we think about the benefits that have been in place during the pandemic. I'll share my screen. Okay, so hopefully everyone can hear me now. I'm sharing my screen and I've taken over the slide advancing. So let me move forward here. So if you're not aware of New York State of Health, I want to again take a moment to share about what New York State of Health is and who can get coverage through the marketplace. Of course, I think all of you are familiar with probably the Affordable Care Act. Some folk knew as Obamacare, which was created to make health insurance accessible for all Americans. The whole idea is that people who needed access to health insurance and, of course, health care would be able to get it through marketplaces that were implemented in every state in our nation. New York State is one of the states that opted to design its own marketplace and operate its own marketplace, and so um, this is what we're talking about here. So it was created to be a sort of a one-stop shopping experience where New Yorkers could come and obtain both subsidized and unsubsidized coverage. That's coverage with and without financial assistance, which I'll talk about a little bit more in a moment. It allows people the opportunity to easily compare various health plan options, and they are many. And we have some help that all New Yorkers have access to help guide them through the process here. And that assistance is provided free by a number of certified enrollment assistors. And I'll describe those a little bit more in detail in a moment as well. This is the only place where New Yorkers can come and apply for coverage and also apply for financial assistance that comes in the form of federal tax credits and serves to help reduce the cost of monthly insurance premiums. Through New York State of Health, New Yorkers can enroll in qualified health plans. Those are that's the private coverage that comes with or without financial assistance, depending on eligibility. We also have the Essential Plan, which is a basic health program for New Yorkers with lower income. We have Child Health Plus, and then we have our Medicaid program. And so New Yorkers can enroll in all of these programs through our marketplace. And then I just want to emphasize that this is available to New York State residents who are lawfully present. Just to update you on where we are today, the marketplace opened in 2013, and I've been a part of the team since before we opened our first or launched our first open enrollment period. Now today we have more than 6.5 million New Yorkers who are enrolled in coverage, and that represents about 1 in 3 New Yorkers. Since 2013, the uninsured rate in New York State has dropped to from 10% to below 5% for all ages, and for our children, from 4% to below 2.4%. About 1 million New Yorkers have gained coverage since the implementation of the Affordable Care Act. So let's talk a little bit about what benefits are included in the health plans and the financial assistance that you've heard me allude to earlier. The marketplace, all of the marketplace plans have very robust coverage. So what you're seeing here, what we have referred to often as the 10 essential health benefits. So you'll find that all of these benefits that you see here listed here are provided in every plan, regardless of which program you enroll in. So whether it's Medicaid, Child Plus, Essential Plan, or the Qualified Health Plans, all of these benefits are required benefits. And so you'll see people getting free preventive care, inpatient services, outpatient services. I'm not going to read through all of these, but highlighting a few: emergency services, lab and imaging, prescription drug coverage, another big one there. I want to point out that pediatric dental and pediatric vision are required in every plan, and that's different from adult dental coverage, which may be available in some plans. And you'll hear me talk a little bit more about the essential plan in a moment as well, where adult dental and vision actually are now free as of this last year. So in terms of when you can enroll and how you can enroll, actually, let me back up for a moment, because I said I wanted to talk a little bit about financial assistance, which I have not included here. But let me just say, again, for our, and I'll talk a little bit more about this as it relates to the American Rescue Plan, which came about during the pandemic. But anyway, for our qualified health plans, individuals can apply for financial assistance. And if they qualify based on their income, that financial assistance becomes available to them right away. And it, again, really cuts down the cost of the monthly premiums that individuals would pay. So when and how can I enroll into a New York State of Health plan? So let's first talk about Medicaid, Child Health Plus, and the Essential Plan. These plans are open all year round, so they are not restricted to enrollment during our annual open enrollment period. So you can enroll if you qualify for these programs, you can enroll all year round. Of course, we're not advocating that people wait. We want people to get coverage as soon as possible, but they are available year round. Our qualified health plans, which are the ones where you can get the financial assistance or the tax credits to help reduce your costs. These you enroll in typically during our annual open enrollment period. Of course, we've had some extraordinary circumstances over the last couple of years with the COVID-19 pandemic. Throughout the pandemic, New York State of Health's open enrollment period has remained open, and today it's still open, and we anticipate that it will continue to be open during the ongoing public health emergency. So at some point, we hope that the public health emergency will end as things get better related to the pandemic, and then we'll shift back to our annual open enrollment period where it opens and closes. But right now, it's still open. Outside of an annual open enrollment period, typically individuals who have certain qualifying life events would get a special enrollment period created just for them. And during that time, they can come into the marketplace and enroll. So qualifying life events are things like loss of health insurance from an employer, for example, or the birth of a child, or marriage, or relocation to a different from another state, or to a different county, or something along those lines, similar to qualifying life events that many are familiar with from coverage that they may have had from an employer. Um, so again, you've heard me say that this is ongoing through the public health emergency, and the idea is that we wanted to give New Yorkers more time to enroll. And we also, of course, understand the importance of, especially now during a pandemic, of having health insurance coverage. And so we want to make sure that New Yorkers are able to get coverage and are able to get care when they need it. Um, Let me continue on here. I'm going to go down to the next slide here. I want to emphasize some sort of time frames that you need to be aware of. If you're needing coverage and you enroll by the 15th of any given month, your coverage is then effective by the 1st of the following month. So again, as you see in this chart here, if you enroll by July 15th, you'd have coverage available by August 1st. By August 15th, you'd have coverage available by September 1st, and so on and so forth. Of course, if you enrolled after the 15th of the month, then you would not have coverage available by the beginning of the next month. It will, so in this example, if you enrolled by July 16th, for example, instead of having August 1st, effective coverage, your coverage would be effective the following month, which would be September 1st. In terms of how to enroll, we have a state-of-the-art web applications and a website that you can use to fully enroll in health insurance. Of course, we also have our customer service center where individuals can call the 855-355-5777 number and get questions answered, as well as completely enroll in an application. In fact, if one were to begin an application on the website and find themselves stuck and unable to complete their application, they could call the customer service center and a representative would be able to help them complete that application over the phone. We also have our enrollment assisters. So you heard me mention certified enrollment assisters who are available in every county of the state. They speak multiple languages. As you can see, we have folk who can provide assistance in about 38 languages here in the state. They are available to provide free expert assistance with enrollment. Again, there's no cost for this, and they're available in communities near you. We have a resource online on our website. You see the link here where you could go in and, for example, type in your zip code and type in maybe a specific language, filter by specific language need, and you can find assisters that are nearby who can help you enroll in coverage. So that's a great resource and tool. Outside of our enrollment assisters, we're also able to provide assistance to New Yorkers who speak virtually any language. So it's not just the 30 languages spoken by our certified assisters. We will provide telephonic interpretation services to provide language assistance and application assistance to New Yorkers, regardless of what language they speak. Just so you get an idea of how New Yorkers enroll in coverage, you can see that 79% of them, or almost 80% really, get help from an enrollment assister. And, we know that insurance can be fairly complicated, and kind of understanding it and what factors to consider when making a choice for a plan. These things can be complicated. Making sure that your doctors are providers of choice are part of a plan's network, making sure that medications that you need to take are part of the plan's drug formulary. All of these things can get a little bit complicated, and so that's why we have thousands and thousands of enrolled certified application counselors, navigators, and health insurance agents and brokers who can provide assistance for you. So now I want to turn to talk a little bit about some of the important updates. One very important update, I mentioned the Essential Plan. Our Essential Plan was created in our second year of enrollment. And again, for states who operate their own health insurance marketplaces, the federal law, the Affordable Care Act, allows these states to create a basic health program for lower income New Yorkers. Of course, we have Child Health Plus and we have Medicaid, but for individuals whose income was slightly higher than Medicaid eligibility guidelines, um, but not high enough where they felt that they could afford to get a qualified health plan, even with very generous tax credits. Um, we created this plan. We found that folk would say, even with the tax credit, it was unaffordable and they would just forego coverage. And so now this basic health plan was created. It used to be that individuals would pay either zero premium or $20 premium, depending on where their income fell within the income eligibility uh, range. But last year, um, with the New York State budget, this became free. So there's no premium for the essential plan at all. So all individuals who qualify for the essential plan will not pay a premium. In addition, free vision and dental coverage was added to all of plans for those who qualify for the essential plan. There's still no deductible and there's still free preventive care. And again, as I said earlier, it covers all the same robust benefits that you find in every plan that's offered. Those 10 essential services or benefits that I mentioned earlier, um, you'll find them here as well. This little chart at the bottom just gives you an idea of what income looks like. So if you're an individual, the most you can make and qualify for the essential plan this year would be $27,180. For a family of four, you'll see that at $55,500. These numbers change annually based on the annual federal poverty level scales. So we adjust these each year accordingly. I also mentioned the American Rescue Plan, which was signed into law in March of 2020, March 11th, 2021. And this was to help lower the costs for New Yorkers by expanding the financial assistance. Essentially, what happened is the eligibility guidelines were expanded. And typically, those, those enrolling in a qualified health plan whose income was up to 400% of the federal poverty level would qualify for some form of financial assistance. The American Rescue Plan came into effect and has even expanded that. So people who previously did not qualify because their income was too high may now find themselves qualifying for financial assistance. And those who had already qualified find themselves getting additional financial assistance. And so I'll give you an example in a moment of what that looks like. So again, this expanded coverage is available for both current and new enrollees. And if you or someone came to the marketplace, looked at a plan, maybe applied for coverage, and found that they did not qualify for financial assistance, we would urge them or you to come back and try again because you may be surprised at what you qualify for. Um, Again, for folk who were already in our system with a plan, those those higher tax credits or the additional financial assistance was automatically applied, and this was a great offering. One note is that this is set to expire at the end of 2022, so it was a 2-year thing. It was to provide additional assistance for all of the difficulty that many people were facing with loss of jobs or reduced income, et cetera, during the pandemic. So this is set to expire in 2022. There are many efforts underway, of course, to try to get this extended beyond 2022. And as of yet, we don't have an answer. There has not been a ruling on this. So just to give you an idea, for an individual in New York City earning $35,000 per year, you can see with $35,000, that individual would not qualify for an essential plan. They would come into a qualified health plan. And previously, they would have received $359 monthly in tax credits to help pay for their insurance premiums. Now with the American Rescue Plan, they're getting $478 per month. So you can see the additional savings for New Yorkers that came through this. So the insurance premium was reduced from 278 down to $159 per year. This individual would have saved about $1,400 over the course of a year with the American Rescue Plan benefits applied. I want to talk now about some other important changes that are coming throughout the pandemic. New Yorkers who were enrolled in coverage were being automatically renewed. If they were in our public health insurance programs, Child Health Plus, Medicaid, and if they also qualified for the Essential Plan, they really haven't had to take action to maintain their coverage. They have been automatically renewed. As we look forward now to the potential unwinding of the COVID-19 public health emergency, um, it is important that we inform New Yorkers that they will have to come back and take action. And so we have begun a fairly robust public education campaign to let people know what actions they need to take. This includes a paid advertising campaign to remind New Yorkers about what is needed to renew their coverage and to maximize the potential for auto renewal. So essentially, what we're asking people to do is to opt into our texting program where they would receive alerts that would tell them exactly what they need to do for renewal. We want to make sure that people don't miss out on coverage or have lapse in coverage because maybe they've moved or they failed to update their information, their contact information, their address, et cetera, et cetera. So we're inviting people to take those steps, but also to opt into our texting campaign so that we can keep them updated. We've created a new web page or a new page on our website, I should say, and this is available in English, Spanish, and traditional Chinese, so people can see what steps they should take to get prepared for this unwinding of the public health emergency. Presently, we can't even really give you a full date, a concrete date of when that's happening. We right now think maybe October, but we really don't know just yet because this is a decision at the federal level. We are promised that we will have notice, I think about 90 days in advance when that's going to take place. We have not received such notice right now. So at the moment, we're anticipating perhaps October, but that could change. So stay tuned. Our website will always be the place where you can find the most up to date information. And so I'll invite you to stay tuned by visiting our website and specifically this page that talks about the changes that are coming. Just to give you an idea of kind of what that campaign looks like, these are some of the ads that we're launching, and you can see we're doing it in multiple languages. So you see Chinese, Spanish, and English here. We do have some of our materials and our information in quite a few other languages as well. And I'll talk about that a little bit more in a moment also. And if you're wondering, if you're part of an organization, for example, and you're wondering how you might help, I just want to invite you to, again, take a look at our website, particularly our digital toolkit related to this public health emergency ending. We have created some sample language that you might send out in an e-blast, that you might incorporate into a newsletter that maybe you send out to members or constituents or the community, social media posts that you can really just take language that we have or posts that we've already designed and drop them into your social media. Website posts, same thing. We have language ready for you to use if you are interested in posting information about this so that the folk who you work with can see this information. And of course, if you're involved in community events that you host or participate in on a regular basis, we will have some print materials as well that we will be glad to share with you that you can distribute at those events. That sample language and those posts you can find at the address that you see here. And again, we invite you to stay in touch with us, continuing to visit our website for regular updates and the latest information. To learn more about New York State of Health, we have a host of resources on our website, including educational videos, print materials. We have at a glance cards that talk specifically about each of the different programs that we offer. You know, I mentioned the Qualified Health Plan, I mentioned Medicaid, Child Health Plus, and Essential Plan. We have an at a glance card that gives a little bit of a highlight of what's covered. And on the back side, you'd find some additional information, more details on, you know, for example, whether or not you need to get a prior authorization or approval, things like and then co-pays and all that sort of stuff. You'll find that information on the back of these cards. And so we have a host of fact sheets that discuss everything from why it's important to have health insurance to health insurance for young adults who often find them feel invincible and feel like perhaps they don't need health insurance. We have, you know, information for immigrants and all of these different things. So, and then we have our RAC cards as well. And so, a lot of information on our website, and we invite you to take a look at some of those. And maybe again, there's a way for you to link to or share some of these resources um, in or with, you know, with organizations that you're a part of. And I'm going to move on here and just share that our materials are available in 27 languages. So we have required languages that the state health department requires. In fact, I need to update this slide because just recently we've added French and Urdu to the required languages. These are by executive order from the governor's office, and so that means that all of our essential documents need to be translated into those languages. And then we have select materials that are also available in an additional 15 languages. Really, it won't be 15 because two of those will move up to the top there. Is basically what will happen. So an additional 13 languages. Most of our main materials, like the ones that you've seen me share a moment ago, are available in all of these languages. Also on our website, you'll find resources for, you know, finding a health plan, finding providers, making sure that the providers, again, that you are interested in or wanting to see, needing to see, the healthcare facilities included. You can look up to make sure as you are deciding on a health plan that the doctors that you need to see are part of that plan's network, et cetera. And the same thing again for the facilities that you need to go to. So again, our certified enrollment assisters, our experts on the ground, can help walk you through all of this. And I talked about how you can contact or find an enrollment assister near you. Again, this is on our website. Find a broker or a navigator. Simply, if you know the person's name, you can put their name in. If you know the name of the organization, um, you can select them from a list here. You can just simply you can simply say I want to find a navigator in a particular county, or one who speaks a particular language, etc. But anyway, these are various filters that you can use to search for someone that meets your needs. And of course, we're on social media, and you can see here our social media pages, you know, Facebook, Twitter, YouTube, Instagram, LinkedIn, and Pinterest. And so we invite you to follow us on these various platforms, and to share, reshare, or whatever information that we have. And with that, I'll stop and entertain questions if there are any.
Hey, all right. So let me see. I cannot see the chat at this time. Let me look and see if I see any comments actually. So there are no questions in the comment box, but I'm
Okay.
sure that if they do come up with any, they'll drop them there, or they could reach out to you at your different means of communication. Um,
Sure.
thank you for being with us. I'm definitely a true believer in health as wealth, and we all definitely need to have insurance because we never know what tomorrow is going to bring.
Yes.
Thank you,
Thank
Ms.
you. We're pleased to be with you again. We've been participating for several years now, and we're glad to be a part of celebrating Juneteenth with you, but also bringing vital information and resources to the community. I also sent along a PDF version of the presentation that can be shared with participants who request it. So, and your team knows how to reach me if I can be helpful, or if there are questions that come through later today. Feel free to reach out.
Perfect. So, community, I hope you received that message. Feel free to reach out if you'd like to receive those slides by PDF form. Just ask and you shall receive. Thank you, Kelvin. We appreciate you and see you next year.
I'm sure you will. Thanks very much.
Have a great day. Thank
All right,
you.
you
Enjoy your
too.
Father's Day as well if you're a dad.
Not exactly, but I have many spiritual kids and nieces and
All
nephews, and those that I've
right.
mentored. So I'll
Day.
be a proxy dad.
All right. I love it. I love it.
Thank
Thanks
you
again.
all. Have a great weekend.